The death of a Stanford nurse whose body was found near the Dumbarton Bridge last week is shedding new light on struggles that healthcare workers are facing during this pandemic.
KTVU's Evan Cernovsky spoke to friends of Michael Odell and other nurses about the mental toll they're all facing. He has their story new at 10.
It's just been a nightmare. It's a surreal nightmare. It's horrible.
Joshua Paredes keeps wondering if there was something that could have been done to save his close friend and roommate, Michael Odell. The 27-year-old nurse at Stanford Hospital died last week. Investigators believe he likely took his own life after abruptly leaving in the middle of his shift. Odell's body was found floating in the waters in Fremont near the Dumbarton Bridge.
I don't understand how this happened.
His friends want to know if the hospital did enough to find Odell that morning before it was too late.
A nurse doesn't just leave their patients for no reason unless they're in danger. That's the only reason that would happen, or they're hurt somewhere.
Paredes, who's also a nurse, said hospitals like Stanford need to be more aware of the burden on so many of their nurses as the coronavirus drags on.
We're running on skeleton crews right now, so nurses are exhausted. The new normal is for nurses to work 48 hours a week, which is Michael was doing.
In a statement to KTVU, Stanford hospital officials said they were deeply saddened about Odell's death. And, quote, upon being informed that Odell may be missing, we alerted authorities and worked with them to help confirm his whereabouts. Several of our nurses personally participated in the search efforts. Odell's death may be an extreme case of a growing problem in healthcare. A recent poll among healthcare workers published in the Journal of Internal Medicine found 74% of them had depression, 37% reported PTSD symptoms, and 15% had suicidal thoughts.
The pandemic has gone on so long that we are no longer able to tolerate the stressors of the position, and we are in immediate help. And we are sounding the alarm.
David Hernandez is an ER nurse at Stanford Hospital. He didn't personally know Odell, but said his death struck a chord. He said too many nurses don't do enough to care for their own mental health and face troubles like depression, anxiety, and exhaustion every day.
You fear that if you open up that you're having mental struggles, that perhaps that will affect your professional career. That will affect your development. It could affect your advancement.
Evan Cernovsky, KTVU, Fox 2 News.
And if you or someone you know needs support, you can call the National Suicide Prevention Lifeline at 1-800-273-TALK. That is 1-800-273-8255.